Well, welcome everybody to the Spine and Rehab Specialists podcast series, episode number 11. Today we're going to talk about ankle and foot injuries, ankle and foot problems. With me today is Lukas Gilmore, one of our physical therapists. He was here from Michigan. He's enjoying the really hot weather. I mean, we've been in a sauna lately, so are you enjoying it?
I'm trying. Staying cool. Doing a lot of swimming.
Yeah, I guess it's better compared to those Michigan winters, right?
Right. Oh, absolutely.
Yeah. And like they say, it's a dry heat. The sauna is a dry heat, and so is my oven. But oh well. So today, talking about foot and ankle injuries, and that really is an area that a lot of times kind of is underestimated, right? It's not very glamorous. It's not very exciting, but yet it's important, right?
It's super important. It's the foundation ultimately.
So when we're looking at from a physical therapy standpoint, or just in general like a medical standpoint, what are some of the things that make the foot and ankle so important?
Honestly, I really like I just said, I think the fact that it is the foundation where that's the first contact to the ground. You're relying on a strong mobile ankle and forefoot, rear foot, all that stuff. You're really relying on that for everything up the kinetic chain. So not just the ankle and foot, but also the knee, the hip, the back, your side to side walking, whether you're stepping, whatever. Any dynamic movement, you really rely on a good strong ankle and foot. And so if you have any deficits there, that likely even kind of goes up. So let's, for example, talk about a squat, for example. If you are doing a squat and you're going into like a flat foot position, or you lack true ankle dorsiflexion, that's going to have resulting impact on the knee alignment, where your hips go during the squat. You want to stay nice and symmetrical, but without that, you're kind of predisposing yourself to injuries, whether it's knee valgus, where those knees kind of buckle in, or you're kind of putting too much shear forces on your low back. If you have, like I said, lack dorsiflexion. So you really have to make sure you have a good foundation before you progress with anything else.
Yeah, so if you don't, if you either don't have that good foundation or you have problems in the ankle and foot, it can really start, creating problems up that kinetic chain. So into the knee, into the hip, maybe even into the back. So yeah, it is very important. And it's I think it's just interesting to see how much it's gotten ignored. I know, my wife Bonnie, our resident athletic trainer, always talks in her class at UTEP about how feet get ignored so much, and she'll put up pictures of the feet of beautiful models, and they're horrible. They have like calluses and bunions and everything. So they're beautiful.
Toenails long.
That probably too, but it's really it comes down to they wear high heels all the time, and that's just that ruins their feet. But nobody looks at them. Like you don't see pictures of them anywhere. You see the pictures of the rest of their body, but not their feet. But their feet are so important.
Absolutely.
So what are some of the maybe some of the injuries or some of the problems that can happen in the feet?
So honestly, there's a ton. So we kind of mentioned it earlier, but talking about plantar fasciitis is a really big one. That one you see a lot with like runners. You also see a lot of kind of pes planus, or flat feet in general. You have injuries where you have that bunion, or you kind of bring in that big toe in. You have all sorts of tendinitises, whether it's in the heel cord, which is your Achilles. You have the pretibial muscles, so all those muscles are really contributing to kind of bringing that shin forward as you're walking. But also another thing is that you're really talking about is more just that calf tightness, and I don't know. What are you thinking?
Well, I would say let's pick the first one that you mentioned, plantar fasciitis. Let's dig into that a little deeper. So plantar fasciitis. So your plantar fascia is really the strong tendon plate on the bottom of your foot, right? That really kind of it kind of holds your foot together, as well as it really helps as a shock absorber for your body weight with every single step that you take. Even more so in running, it really is a protective mechanism. But there's a lot of problems that happen with it, and I think a lot of times people don't really understand what it is. So let's dissect it a little bit. So what happens to that plantar fascia, in these injuries, called plantar fasciitis.
So ultimately, it just gets inflamed, right? So if you're using it and you're not using it well or overusing it, it gets inflamed, it hurts. So ultimately, it's tight.
Yep. And then, so what happens a lot of times, kind of one of the trademarks for plantar fasciitis is those first couple of steps in the morning. Like the first steps out of bed, you're stepping on that foot, and it just hurts like crazy. A lot of times to the point that people can't even put their weight on their foot. So they think there's something horribly wrong with it. Hey, if you can't walk, then there's got to be something horribly wrong. When it's actually relatively simple, in our world, right? So and even the treatment for it isn't all that complicated.
It's really not.
So we're looking at, it's probably tight, plantar fascia in the foot, tight calf muscle. So we stretch that, right?
Right. Yeah, like to work on a lot of eccentric motions, really end range, stretching actively, and I like to really add in a little bit of a mix with the little ball in between the heels to really emphasize that active squeeze of the heels. But yeah, ultimately, it's stretching.
Yeah.
And
it just sounds so simple. When you tell a patient that, it's like, you got to stretch. And they're like, I'm sure I need to stretch. Everybody knows that they need to stretch, but ultimately, that's not going to fix this horrible problem that I have, that I can't walk when I first get out of bed. But really, it comes down to that. There's maybe a couple of other things you can do. I know I've done some dry needling on it or so, but and I know people have done ultrasound on it, but in general, it really just comes down to a lot of stretching.
Right. And
even to the point of maybe having something that stretches your foot at night, a night splint. But it's all about stretching. It is really that simple.
And it's actually kind of funny. One of my close friends from Michigan, his sister, he sent a picture of his sister in crutches with an immobilizer boot, and saying that she was diagnosed with plantar fasciitis, and it sounded like a grave term. And it's like, just stretch your calves and stretch your feet out. And he just kind of laughed, like, but no, for real, like, try that. See how it goes.
Yep, it is that simple. And I think sometimes they go overboard. I mean, it's people will get like an MRI, or they'll go for like a steroid injection, which, by the way, hurts like the dickens in your plantar fascia. But a lot of times stretching will solve that. So
another thing to really hit on is ankle sprains. Ankle sprains are really common. You see a lot of those in the clinic. Just have a lot of difficulty with that. A lot of athletes will roll their ankle, typically like an inversion ankle sprain. So for those who don't know, that is basically where that kind of toe goes inward, and you kind of put that weight over your ankle and really distribute all those pressures right through the outside of the foot and ankle. And those can be tough. Those can be really tough, especially like the grade 3s, like where there's the complete rupture. Really is
just for our audience, if you don't know what those grades are, grade 1 is pretty much maybe just a little bit of a stretch on the ligaments, but there's no damage to the ligaments. So those are your very basic ankle sprains that usually recover pretty easily. Then your grade 2 is where you have some tearing of the ligament, but they're still intact. And then grade 3 is where the ligament is completely torn. And a lot of times the amount of pain and swelling and everything probably kind of goes with it, although you can have a grade 1 that hurts a lot and a grade 3 that actually may not hurt quite as much if the ligament is completely torn. So, and who hasn't had an ankle sprain? I think probably everybody has, if you're somewhat active in life, because you can have it just stepping up a curve. You don't have to be an athlete to get an ankle sprain. And they usually rehab pretty good if they're a grade 1. But the problem is, if you have multiple grade 1s, you're now going to start having grade 2s and ultimately grade 3s. I think that's the biggest problem with us, with patients that have an ankle sprain. It's not that hard to rehab an ankle sprain. The hard part is preventing them from happening over and over and over again, and really becoming a big problem.
Yeah, even in, like, to get in a little bit of the anatomy, so you have the ligaments, and if you tear them completely, your body relies on little mechanoreceptors in the ankle to respond and reflexively contract those muscles. Well, without those, if those are completely severed, just like an ACL, like if an ACL is severed, you lose those mechanoreceptors. If you sever those, you lose a lot of your reaction time. So like your chance of re-spraining it after those have been damaged is a lot higher, because your muscles, they don't react as fast. Like I think it said at like 150 milliseconds it takes for your muscles to respond, but the mechanoreceptors can respond in like 90 to 100. So just losing those few milliseconds make a big difference for reaction time.
So that's why a lot of what we do in therapy for an ankle sprain is not just the immediate rehab of controlling pain and swelling and getting motion back, but a lot of what we call proprioceptive exercises, right? To really try to get those mechanoreceptors to maybe respond a little quicker or have that connection with the muscles a little quicker.
Absolutely.
You want to go over some of the exercises that we do for that, because that's when it gets to be fun, right? With a patient.
Yeah. Any single leg balance stuff on the foam, on the BOSU. For those who don't know what a BOSU is, it's just like a round half ball. You've probably seen them in the gym. But those things are really nice. But you can do a lot of like ball catching in the single leg stance, or just doing some agility ladder exercises that are going to really work on that side to side motion and kind of responding to that.
Yeah, that's what I think that's the fun stuff of what
That's
we're doing.
the
We even
fun
have a
stuff.
sand pit out in the back on our physician's clinic, and we have people jumping and running and everything in there. It's really kind of fun, but you got to make a challenge to the ankle muscles, to the foot muscles, to really have to respond quickly.
Yeah, and you don't even need to fatigue it out. Honestly, just getting those firing and getting them working and repetitively do that over time, it gets better. It gets a lot better. And it gets better quicker. You don't have to necessarily build the muscle. You just need to work on that neuromuscular connection, which is really cool.
Yeah, it's really more the quick firing of the of the muscles and the coordination of the muscles. Not necessarily, you don't have to have the biggest calves in the world to do that.
Yeah, right.
So
if you do, just stretch them.
Yeah, exactly right. So. Let's see. Anything else that stands out? Of what do we work on in the clinic?
Honestly, one thing I really like to focus on is footwear. So you kind of hit on it with the heels. Footwear. So if you look at a regular shoe, you have the front, and the middle, and the back. Well, a lot of times, if that front of your tennis shoe is really crunching those toes, you lose a lot of your stability through your toes, and you're kind of splaying your toes. You're kind of bringing those toes apart. You rely on that like stance to kind of recruit all the plantar muscles, as well as kind of like the pretibial muscles, and just works on the coordination of the muscles. And if you kind of eliminate that and your toes are scrunched in that front toe box area, you're really limiting your ankle stability. And so especially if they come in with like ankle sprain, their likelihood of spraining their ankle in a crunched toe that's really narrow kind of throws it off. So I like to tell patients, if they're able to do it, to try to walk barefoot, because walking barefoot really is like the best way, because you're in contact with the ground, you recruit all that neuromuscular connection, and it just recruits the muscles more effectively.
Yeah, I remember when I was young, we grew up pretty close to the beach, and we would go walk barefoot on the beach, and it was awesome.
Yeah.
It really is, it's awesome. I think that's great therapy. So I think we all need to move to the beach. Start walking barefoot. Then we don't need physical therapy anymore, right?
Yeah.
So
it's worth it.
All right. So so there's a lot of stuff that we can do for people with ankle and foot problems. Some of the things that we do too in the clinic is I wanted to touch on the musculoskeletal ultrasound. So this is testing. So it's a diagnostic test that we do that a lot of times can reveal some of these tendon issues and ligament issues. You can even look at the plantar fascia to see if there's truly inflammation or if it's more of a chronic problem. Such an advantage of we're doing that over an MRI. Where an MRI, you have to go into this tube and lay still there for 20, 30 minutes or so. Well, with your MSK ultrasound, it's really dynamic, and you get to look at it. So that's definitely one of the things that we're doing. I've already mentioned the dry needling that we do on some of these ankle muscles. What else do we have that's really useful for people with foot and ankle problems from a rehab standpoint? Want to talk a little bit about the pool?
Yeah, the pool is great, because at Spine Rehab we have a pool with the treadmill in it, and you can obviously have the variable speed, and you can there's cameras looking at your feet from the front, from the side, and you can really see everything what you're doing. And obviously with the buoyancy of the water, you're off weighting it, very similar to the Ultra G in a way. You're off weighting it, and you can really work on that coordination and rhythm. That's huge.
Yeah, especially if somebody has pain in their foot because they're weight bearing, because their weight is on it with every single step they make, and you can take that pain away. They can really concentrate on the right way to walk, and walking pain free, walking on a really good walking pattern, a gait pattern. and then hopefully little by little you can transition that to walking on the regular land with 100% weight bearing. Yeah, and the Ultra G is awesome too. So the Ultra G is our anti-gravity treadmill. It's NASA developed for astronauts to be in low weight bearing. It does kind of look like it's a space age kind of thing. It's this big.
Did you wear a helmet?
Not quite a helmet. It's special shorts though. You got to wear special shorts with that. And it's again you're partially unweighted. The nice thing about the Ultra G compared to the pool is you're automatically a certain percentage unweighted, and if you're 6 feet you're a little less unweighted than if you're 5 feet. But on the Ultra G we can actually objectively completely have it. I can have you at 78% of your body weight if I want to. And the really nice thing is again it has cameras where you can look at it, and working on gait pattern and everything is pretty awesome.
Right.
So we have a ton of things to really work on that. So we do make it probably a little bit more glamorous and exciting than it seems like on the outside.
Yeah, I agree. Yeah, with the combination, you can supplement. You can kind of make the transition from all aquatic to land through the Ultra G, and that's really nice to have.
Yeah, awesome. So really, for anybody out there that has problems with their feet and ankles, even if it's it may not seem like a big issue, I really think you need to address it early on, because it can start giving problems higher up the chain. And walking is so important. So please, if you have any kind of problems, give us a call, and let's talk a little bit about that and see if we can help you with it.
Yeah.
So
no, I think we can for sure.
Any parting words of wisdom?
No, nothing comes to mind. I really appreciate these, and these are a lot of fun. So
good.
Take care of your feet.
Yes, absolutely. If you have a problem, do something with it. I don't care how old or how young you are. Come see us. All right, so that was our 11th episode of our podcast series. Looking forward to the next one in a couple of weeks.